Hello, my name's Lorraine Dunn and I'm a locality coordinator and practice educator for the End of Life Partnership. I'm also a facilitator of advanced communication skills training, and this video has been made to hopefully give you some guidelines and tips on how to break bad news over the telephone. Although it is preferable to give bad news face to face, during this difficult and unprecedented time of COVID-19 pandemic, we will be most likely to be called upon to break bad news over the phone. This will probably be unavoidable and therefore very challenging to convey all the necessary and appropriate information. For example, a loved one who has sadly died of coronavirus. When giving bad news over the phone, there are some general guidelines to follow. Firstly, ensure that there is adequate privacy and time for the call. Make sure pages are turned off and staff know that you do not need to be disturbed at this time. When the relative has answered the phone, ask if it's an appropriate time and place to have a serious conversation and if somebody is with them. If not, ask if they would like you to ring them back at a later time. Go on to ask what they know, expect and feel about their loved one's condition, as this will allow you to understand what they know already, to give you a base to work from and a better understanding of their loved one's condition. Once you have this information, go on to give a warning shot, something along the lines of, "Unfortunately, I have some very bad news to give you." This prepares the person for what's to come next. And then go on to give them the information and explain what has happened. Be truthful, but also caring and compassionate. It's important to convey empathy by using your tone and pitch of voice, as non-verbal communication is very difficult over the phone. Words such as passed away or gone can be misunderstanding, and it can lead to misconceptions. By using the word died, it gives the situation more clarity. The relative knows exactly what has happened. Then pause to allow them to process the information. Show compassion and empathy throughout. Their immediate reaction may be stunned silence or disbelief, or if they cry, acknowledge these responses. Say, "I can't imagine how difficult this is for you." Say, "You're sorry for their loss." If they apologise for crying, reassure them that it's okay, it's understandable. Be mindful of your tone of voice, and if you can, try and avoid giving them lots of information at this time. Allow them to become slightly calmer before you go on to give them further information. Offer words of comfort, ask them how they feel and acknowledge it. Then move on to giving them information on what will happen next. On another note, if you're phoning relatives to inform them of their loved one's deteriorating condition, avoid jargonistic terms such as "more poorly", as again this could lead to misconceptions, ambiguity and misunderstandings. Again, be honest and truthful. If the patient is sick enough that they might die, then say it. But be empathic and compassionate when doing so. This guideline is based on the SPIKE strategy of breaking bad news. And as you can see from this poster, it sets out 6 steps to follow: setting and situation, perception, invitation, knowledge, empathy, and summary. Another guide that complements this video and guides you in talking to relatives over the phone is this poster developed by Dr. Antonia Field-Smith and Dr. Louise Robinson at the West Middlesex Hospital. It gives simple step-by-step guidance on compassionate phone communication during COVID-19. This can be found as a separate resource on ePage. Hopefully, by using these guidelines, it will help and support you in breaking bad news over the phone. In addition, the person you are speaking to will feel supported and acknowledged at this devastating time. We do have lots of resources available for you. Either access the End of Life Partnership website or Cheshire ePage for further information, support and guidance. Thank you.